Good afternoon. We'll now start. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. A reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate as shown below. The link has already been placed in the chat box. Another reminder, getting 50 OLETE certificates will entitle one mentee to a voucher for a free ROJoson telemedical consultation. Another request is that those who are not planning to take the OLETE, but which I encourage you to do so, in this OLETE, I ask for feedback to my pep talk. If you're not going to take it, please type in your feedback in the chat box, okay, during the open forum. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face in the video. Ready? Everybody ready? 1. Okay. Ipahabol? Okay. 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. So here listed down are the contents of the core course. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. Samples are shown here. I've tackled practically everything, every topics here. So this may take about 3 years or longer depending on the enthusiasm of the mentees. My pep talk today is entitled Breast Cancer Awareness Month, October 2022. The empowerment objective is for the lay people to have an awareness or understanding of the fundamentals and generalities of breast cancer in their health management. The contents of this particular pep talk will be the following. When is the Breast Cancer Awareness Month in the Philippines? What are its objectives? How do we observe, both you and me? And what are my specific contributions? What are the objectives, target impact, target outcome of the ROJoson PEP Talk on Breast Cancer Awareness Month, and what are the focus contents, and then recognition of breast cancer survivors. I will give another outline on the focus contents later on. So let's start with the first topic. When is the Breast Cancer Awareness Month in the Philippines? October of each year is being observed as the Breast Cancer Awareness Month. This is not only in the Philippines, but also all over the world. And history-wise, it started in 1985 in the USA, okay, because it's the breast cancer is very common there. It's a big problem. So then it spread all over the world, okay, and also because breast cancer is the most common worldwide throughout the world. The pink ribbon is an international symbol of breast cancer awareness. So when you wear a pink ribbon, it is a manifestation of your support of the breast cancer awareness. It's also a manifestation of having and promoting awareness of the importance of controlling breast cancer as a health problem in the community and, if you want, in the world. And what are the objectives? Essentially to raise awareness, and I'd like to add to empower the lay people on the following. On breast cancer, specifically, what is it? What is breast cancer? How to prevent, if possible, how to recognize early, how to treat, and then what is the prognosis, etc. And then the other objective is to raise awareness and empower the people on the burden of breast cancer, how it can be controlled in the family and community, specifically how to lessen the number of Filipinos dying and suffering from breast cancer because of late consult and treatment. As I said, the objective that I added here is to empower the lay people, and we will use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan in achieving the objectives of the Breast Cancer Awareness Month. How do we observe? You and me. First, you make efforts to know what is breast cancer, how to prevent if possible, how to recognize early, how it's being treated, and prognosis. By reading, attending lectures and talks provided by DOH and other agencies. There are a lot of them going on in the internet, in all the offices. And of course, my ROJoson PEP talk. Okay. Examine your own body for a possible breast cancer this month. Do a self-examination of your breast if you have not done this before. Consult a physician for a checkup, or if you have symptoms of breast disorder. So this will be your contribution on how to observe the Breast Cancer Awareness Month. So if you do all these things, you are empowering yourself. You are contributing to the goal of the Awareness Month. You're trying to lessen the number of Filipinos suffering and dying from breast cancer. As for me, what will be my specific contribution? This will be ROJoson PEP Talk on breast cancer awareness will be my specific contribution for 2022. Okay. So it's essentially patient empowerment program and education for health development in the Philippines. I will align my PEP Talk with the objectives of the National and Department of Health program. However, I will try to make my PEP Talk down to earth, as reasonable, simple, and practical, cost-effective, efficient, etc., hopefully to better achieve the impact of the national or DOH programs. I will target at least 10 Filipinos who will pass the ROJoson OSIL-OLETE on breast cancer awareness, and this will serve as one of my key performance indicators. So may I request that please take and pass the OLETE. And my objectives will be the following: to create awareness and more awareness, both for Filipinos who are still not aware, and those who have some knowledge of it already, on at least the following topics: what is breast cancer, how to prevent, if possible, how to recognize early, how it's being treated, prognosis. Okay. And this awareness will be measured by my OLETE, online learning code evaluation test exercise. Again, the request will be for you to take the OLETE and help me achieve my objectives. And my targeted impact will be through education and patient empowerment like this. I will try to lessen the number of Filipinos dying and suffering from breast cancer because of late consult and treatment. So I will try to promote early diagnosis and treatment in my PEP Talk. This impact, I know, cannot be to see. It has to be practical and realistic. I won't be able to save all. I won't be able to prevent all death in all patients. Okay. So that's why I said the most realistic and reasonable strategy is to promote early consult and early treatment as just to lessen the number of death and suffering. Lessen. The key word here is lessen. So I have to confess that I cannot measure this impact because it will take me years to do that. But what I can do to show that I have contributed to the program, to the awareness, is that at least 10 OLET, there will be 10 OLET passers who will hopefully practice what they learn in terms of early recognition, consult, treatment, and of course, count and review my breast cancer survivors. Later on, I'll be recognizing my breast cancer survivors. Okay. As I said, at least 10 Filipinos will pass the OLET. I'll be satisfied. So please take the OLET. So what are the focus contents of the PEP talk on breast cancer awareness? This is more specific now. Okay. What is breast cancer? What are the causes? Ways to prevent? Behavior of breast cancer, when to suspect one may have breast cancer, how to screen and how to do breast self-examination, what are the consequences if not diagnosed and treated early, what cost-effective diagnostic tests are usually being done for breast cancer suspect, what are the usual treatment, and what is the prognosis for majority of breast cancer with early treatment. So let's start with the first topic. What is the breast cancer? What is a breast cancer? Breast cancer, simply put, will be cancer originating in the breast, primarily. Doon siya nagsisimula. Okay. Breast cancer is a medical disease when some of the breast cells, there are millions of cells there, which grow uncontrollably with a potential to invade the adjacent body tissues like this. Okay, this is the normal cells, and then it start growing, and then it will invade the surrounding tissues and organs, and then to spread to distant sites. It can spread to the lungs, to the bone, to the liver, to the brain. Okay. A breast cancer usually presents as a solid tumor and not a liquid tumor or a cyst, what we call cyst. Okay. So when you say cyst, it usually contains fluid. Okay. So it is known that it's also known as breast malignancy. That's a medical term, or a malignant tumor of the breast, to differentiate it from benign. So you have heard about benign and malignant, these terms. Okay, benign means it's not malignant, it does not invade or spread to the other organs. And breast cancer is the most common cancer, not only in the world, but also in the Philippines, in both sexes. Okay. This is as of 2020. Okay. And it is more common in the females and in males. So that means some males can also be affected by breast cancer. It is more common in the older age group rather than on the younger females. Usually pag 25, usually it's not cancer, 25 and younger. But if it's 30, 40, 50, okay. So majority will start at about 40 years old. There are so many types of breast cancer, and not all breast cancers are the same. There are at least more than 20 different types, and some have track records of being fast growing and some slow growing. And if they are slow growing, they're associated with good prognosis or outcome. What are the causes? Ways to prevent breast cancer? Up to the present time, the exact cause or mechanism of cancer development, breast cancer development, is not yet known, sad to say. So realistically speaking, there is no known sure way or absolute way for prevention. In 90 to 95% of cases, nobody knows the exact cause. The cause is usually multifactorial. There's so many factors that affect the causation of the development of breast cancer. In only about 5 to 10% of breast cancers due to inherited gene from the parents. Only 5 to 10%. So 90 to 95% are sporadic, so which are not really coming from the gene mutation from the parents. Breast cancer is developed through multiple factors, as I said, just as genetic predisposition, environmental factors, which include the lifestyle, aging, that is difficult to identify. That's why it's difficult to identify a sure shot specific strategy of prevention. There are some things that can increase the risk of cancer that we cannot change. So this include like damaged DNA inherited from the parent. These are the gene. And then the family history. Again, we cannot control that. And then getting older. So though managing certain controllable risk factors such as diet, physical activity, and other lifestyle choices can lower your chances of developing cancer. But again, I have to admit that there is no guarantee, just best effort. So these are the uncontrollable risk factors. Again, being a female is a first uncontrollable risk for breast cancer. Aging, but as I said, males can also be affected, okay, but not so common. So aging, family history of breast cancer, history of breast cancer on one breast, so predispose you to have cancer on the other breast or in other areas. Then inherited breast cancer genes from parents, as I said, this is only about 5 to 10%. And then these are the controllable risk factors which can lessen your chance for developing breast cancer. So let me go to it. So maintain a healthy diet, healthy weight. So this is one way to prevent breast cancer, but no guarantee, but best effort. Have an adequate amount of exercise. Drink alcohol in moderation. Limit the use of hormonal replacement therapy. Avoid exposure to tobacco or smoke. Avoid excessive radiation exposure, especially to the chest. Eat healthy diet, more on plant-based diet. And then, of course, be in touch with reliable medical information on breast cancer risk prevention. So once a breast cancer develops, we're now talking about the behavior of what will happen if you have breast cancer. It has the potential to grow and invade or infiltrate the adjacent bodies, the organs and tissues, and also to spread, potential to spread to distant, meaning far away from the breast, distant sites in the breast. And the rate of growth and spread of the cancer is dependent primarily on the behavior of the mutated gene, so which up to now nobody can identify. Okay. And secondarily on the presence of promoting factors in the person's body like medications, like the HRT, hormonal replacement therapy, and hormonal levels, and in the environment like cancer-causing chemicals or radiations. So once a breast cancer develops, it has the potential to grow and invade and infiltrate adjacent organs and tissues like this. So the breast cancer is somewhere here, and then it's eating up invading the skin already, okay, and also the nipple. So this is late diagnosis already, late recognition and late diagnosis. And it can spread. One of the behavior of the breast cancer is it can spread. It can spread to the regional site or the lymph nodes here. Okay. So sa kilikili now. And then it can also spread to the distant sites like the bone, lungs, brain, and liver. At the moment, based on statistics, the most common site of spread is still the bones and the lungs. When to suspect one may have breast cancer. So you use the alert symptoms or symptom cues for breast cancer. Number 1, breast mass. Number 2, change in the contour of the breast. Number 3, retraction of the nipple. Number 4, nipple areolar skin erosions. Number 5, red nipple discharge. Red, it must be red. Okay. And then armpit mass, meaning a mass in the kilikili. Okay, so it could be related to a breast cancer in the breast itself. So I like to emphasize that because a lot of patients are complaining of pain, one, because of natural cause because of menstrual changes, but a lot of times because of the anticipated anxiety, because breast cancer is so common, because of the fear of breast cancer, it can cause psychological pain. So pain per se, without the above associated alert symptoms, pag walang breast mass, walang change of contour, walang nipple retraction, is not a symptom cue for breast cancer. Okay. Most of the time, in 90% of the time, pain per se, kung wala nito, it's usually due to non-specific cause. It's usually due to hormonal changes, or at times it's due to psychological effect. The most common starting point in suspecting breast cancer is the palpation of a mass on the breast. So although not all breast masses are cancers, the presence of a breast mass is always a red flag, because once you have a mass, it's a toss-up between, is it cancer, is it not cancer? Okay. So once you have a breast mass, palpated breast mass, this must be evaluated by a breast surgeon. So as to breast mass, the foremost in the physical examination is to look for a dominant mass. I like to expound on this because there are a lot of patients who said, we don't know how to palpate for a mass, okay? Or sometimes they confuse a not dominant mass to a real mass. So when you say dominant mass, it's what we call the real mass from the medical point of view. So the mass which is considered as the red flag, meaning it has to be investigated further. Again, as I said, one should distinguish dominant mass from prominent, medyo umbok lang, and unsmooth breast tissues, which are usually part of the hormonal changes, okay, which is called fibrocystic changes, and which is still normal and does not require surgical treatment. So this is an illustration on how to differentiate between fibrocystic changes and the dominant mass. So usually underneath the skin and the fat, you have the breast proper here. So usually the surface of the breast proper is not smooth, usually lumpy yan because of hormonal changes, because of age, because of pregnancy, because of lactation. Okay. So baku-baku yan. So if you're not familiar with, if you don't know how to palpate, you might think that one of the umbok here is a breast mass already. Okay. So in contrast, a dominant mass is one that stands out, okay, different of consistency from the surrounding tissues, as illustrated this way. It can occur here, it can occur anywhere, kahit na dito, no? Okay. So once you feel this dominant mass, it's a red flag. It must be investigated or it must be evaluated by a surgeon. So what will be the diagnostic algorithm of a patient with a breast mass? Once you have a breast mass, first you look for this tip that you can apply. Look for signs of inflammation and infection. So signs of inflammations and infections will be the following. When you have pus, erythema means redness, tenderness, masakit na masakit, flactuancy of the mass, yung na lumulubog, pinipindot, parang pigsa. Okay, so if present, the primary diagnosis is inflammatory or infectious mass or abscess. So you don't have to worry now if you see all these things. Okay. Now, after that, kung walang signs of inflammations, then you look for signs of malignancy. That's the second step. Okay. Signs of malignancy will include the following. If you have a mass with ill-defined border, kasi as we said, cancer invades to the surrounding tissues, kaya yung border niya hindi na malinaw. And then if it's fixed, as I said again, it can invade the surrounding tissues at hindi na siya gumagalaw, fixed. Then retraction, again, it invades yung mga skin, hinihila niya, or yung nipple, hinihila. Then ulcerations, may sugat na. Then fungations. And then if there are also signs of spread, like merong mass sa kilikili, okay, or mass elsewhere, like in the bone, then you suspect malignant mass already. So first step is look for signs of inflammations. Kung wala, okay. So look for signs of malignancy. Okay. Kung wala, most likely benign. Okay. So ito yung example of look for a lump on the armpit. If there's a mass here sa breast, tapos there's a lump here on the armpit, that's a sign of spread. So that the diagnosis should a diagnosis of cancer is highly suspected here if there's a lump here. Okay. If there are no signs of malignancy, more likely, it is a benign mass, especially if the mass is cystic. When you say cystic, it means that the mass contains fluid, and sometimes you can determine this by pressing on the mass. Kung bumabaon siya, hindi siya solid, most likely it's cystic. No? So how to self-screen for breast cancer and how to do self-examination of the breast. So do it monthly. Look and feel for anything unusual. Look and feel for a dominant mass. Yung palaging hahanapin, unusual muna, then mass. And then look and feel for other alert symptoms or signs of cancer. As I said kanina, change in breast contour, breast nipple retraction, nipple areolar skin erosion, nipple discharge, the red one, okay, and then armpit mass. How to do self-examination of the breast? So basically, stand in front of the mirror, look at yourself, okay, with your arms down, and look for change in contour or any bulbs on the breast. And then raise up your hands over the head, and then again look at the mirror for any change in contour, and then palpate your breast, okay, using the flats of the fingers, not the tips. If you use the tips, you're going to palpate a lot of things. You use the flats of the fingers first, so that you will be able to distinguish a dominant mass from the lumpy or fibrocystic changes. Then, so when you palpate your breast, you raise the arm here on the side of the breast that you're palpating, and then go through the entire quadrant. Okay, entire quadrant, the entire breast in all quadrants. Okay, and then after that, do the same on the other side. Again, as I said, when you palpate your breast, make sure that you are putting your arms up because it stretches the muscle here of the chest para mas madaling makita kung may mass. Okay. And after palpating the breast, then you palpate the armpit, okay, both sides, right and left. Okay, look for a lymph nodes. Okay, so when you palpate your armpit, this time your arm should be down para relax yung mga tissues dito, para madaling kapain. No? Okay. Then after that, you press the nipple to see for any discharge. Okay, if it's red, okay, so that's a red flag already. Okay. What are cost-effective diagnostic tests that are usually being done for breast cancer suspect? Basically, I won't go into the details, but you can ask me questions later on. So basically, it's ultrasound, mammography, needle biopsy, which can be the fine needle as well as the core needle, mas malaking kalibre ng needle, and then open biopsy, yung may hiwa, okay, which could be excision or section. So there are various indications of the diagnostic test, which I will not discuss it at this point, but you can ask me questions on that. Choice will be dependent on the comparison of the options in terms of benefit, risk, cost, availability parameters. So examples will be this one. So the doctor should be able to show you once he's recommending something, he should show you a table like this. Okay. So options would be biopsy, ultrasound, mammo, sometimes CT scan. Okay. Then gives you all the information as to the comparison. So example, biopsy, it has the most information that you can get because it's a direct sampling of the mass, okay, compared to ultrasound, mammography, CT scan, which are indirect examination because it's just based on pictures. Okay, then the risk for each. Okay, of course, your biopsy can have some pain. Ultrasound, usually no pain. Then mammography, you have pain on pressure, on compression, and radiation. CT scan, usually no pain, but there is a extensive radiation. And then, of course, you must know the cost for each. No? Okay. Then, based on this table, just choose the most cost-effective procedure that should be done. What are the usual treatment for breast cancer? Again, I won't go into the details, but we can discuss this later on. Surgery is the primary modality of treatment. If you most of the time, if surgery is still can be done, it usually carry a very better prognosis compared to situations in which surgery cannot be done as the primary treatment, in which you have to do chemo before the surgery, okay, or radiation before the surgery. The other options would be a combination of surgery first and then followed by chemo, depending on the extent of the disease, and then hormonal therapy or radiotherapy. And sometimes, as I said, if the mass is so big, chemotherapy is done first, then followed by surgery, radiotherapy, and then hormonal therapy, and then there are other regimens that can be used. Again, the choice is dependent on the comparison of the options, different options in terms of benefit, risk, cost, availability parameters. So this is an example of a table that shows different options of treatment 1, 2, 3, and then what are the comparative benefit in terms of goals. So example, if this option carries the greatest survival rate now compared to option 2 and 3, that should be the priority. But also look at the risk, okay, whether they're acceptable or not acceptable, and then the cost, also look at the cost, and then available procedures that can be done, okay. Then make a decision on this. What is the prognosis treated early? So this is a table that shows the 5-year survival, 10-year survival, and 15-year survival, okay. So you can see that stage 1 and stage 2, it has a almost 93 to 96% 5-year survival rate. Okay, maganda, no? Okay. So, but as you grow older, as you move further, 10 years usually bumababa, but it's still good, no? 80, 70, you know. Compared to stage, when you have stage 4 already, it's 40 only, 40% now in 5 years, and then 24 na lang on 10 years. That's why it's important to go for early recognition, diagnosis, surgical treatment of, sorry for this should be breast cancer, to have a better chance of cure and to avoid unwanted suffering and death. So now I like to recognize my breast cancer survivors. Okay. I have a registry of breast cancer survivors and recognitions. Okay, to better convince you of the importance of early recognitions, diagnosis, and treatment, and to inspire you, of course, I will now present to you briefly the registry of my breast cancer survivors whom I have treated from 1982 to the present. I started my private practice in 1982 after my graduation from PGH. Okay. So that's about 4 years now. The criterion for inclusion in this registry is that at least 10 years in remission, walang hindi umulit, no? After a breast cancer treatment, especially after an operation. Okay, as I said, the primary modality of treatment which offer a best chance for cure will be surgery pa rin. Okay, so this is just registry. What I'm going to present here is just a partial list because not all have followed out with me. Now, in this registry, I have about, because I keep on updating this, 110 breast cancer survivors, okay, at least 10 years, okay, for the past 40 years. And this documentations is seen on this link on the website, okay. Okay, this one, the links, about 110. So these are pictures of those who have lived in remission is about 40 years. Okay, this is Rosario Rosa. I just saw her last 2 weeks ago. Okay, so about 30 years. Okay. Mirna Dequina, 40 years. Okay. This one is Laredo, 30 years, about 30 years. Okay, of course, Radies is with us, I think. And then Sylvia Ordonez. Okay. Okay. 41, I think 41, she's going to share his cancer journey in the Cancer Crusaders Club come December. Ladies. Okay. So summary and takeaway, I have presented all these contents. Okay. I want to read them again. And then also this, the focus contents. So takeaway in relation to patient empowerment, be always in touch with reliable medical information on breast cancer. And knowledge is power, it gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself, yourself, by knowing the fundamentals and generalities of breast cancer in your health management. So with that, I end my pep talk. I hope I have empowered you to have a better understanding and awareness of the fundamentals and generalities of breast cancer in health management. You can ask me questions, detailed questions later on. So before we go to the question and answer portion, reminder, the online Olete learning evaluation test exercise, please take it so that this lecture, my contribution to the PEP, to the cancer awareness program will be achieved, at least 10 passers. Then another come on here, if you have passed the Olete, you can get the certificate. And then if you have accumulated 50, you're entitled to you'll be given a free voucher for an ROJoson telemedical consultation. Okay. Request again, if you're not planning to take it, which I'm not forcing you, okay, please put your feedback in the chat box so that I can document it in my report. So with that, let's have a picture taking. Okay. Okay. One, ready? Okay, everybody in. Okay, one, 2, 3. Oh, pahabol si Abet. 1, 2, 3. Good. Complete picture taking. Okay. Okay, the floor is now open for questions, comments, suggestions, reactions, free consultations. Okay, short consultations. So any questions?
May I ask something?
Sure.
Doc?
Sure.
Yeah, this is Susan, Doc.
Yeah.
Okay. Is we call it BIRAD 4 in mammography reliable, or a breast screening first? Because you remember I went to you showing a mammography result.
You did?
Yeah, and there was a time 5 years ago, and what you did is you took a breast exam of me, and then I had needle biopsy from you, and then afterwards the result was fibrocystic. It's good I went to you, because if I were to just look at the result of the mammography and it says BIRAD 4, medyo kakabahan ako. That's my question and comment.
Okay. So BIRAD's system of reporting is a system of reporting by the radiologist now. So BIRAD stands for breast imaging, reporting, and data system. Okay. So they try to standardize it, yung reporting nila. Okay. So may 0, 1, 2, 5, or even 6. Diba? Okay. So yung 4 na yon, well, when you say BIRAD's 4, it's already suspicious for breast cancer. Okay. Below 4, the 3, the 2, And the one is normal, 2 is probably, 1 is, what's 1? 2, 3 is probably benign, 2 is benign, 1 is negative, no findings, okay? So once your virus 4, it's already suspicious for breast cancer. Now, based on the radiologist interpretation. Remember, these are done by radiologists. Okay, so yan ang ano nila, interpretation nila. Okay, so once you have this virus 4, they usually have a recommendation, biopsy, ganon, di ba? Okay, by the radiologist. Okay, so once you have this, it's better to have to be seen by a breast specialist, a surgeon for that. Because kakapain yung surgeon yung breast mo to check, to correlate the findings. No? Okay. So, I don't, Susan, okay. Was it, Susan, can you show your face?
Yes. Yes.
Can you show
Yes,
your
Doc.
face so that I know? So, is it mammography only or ultrasound?
I don't remember now.
Okay. Usually, they usually commit to the virus thing with ultrasound, and then of course they complement it with the mammography. No? Pag nag-mammography lang sila, usually 0 ang sasabihin nila. They don't like to commit, no? Kaya they put 0, no? So they usually ask for an ultrasound. Pag dumating na yung ultrasound, no? Kaya usually my experience is that a lot of times I just rely on the ultrasound because ultrasound can give you more information, no? Okay, compared to mammography, no? Okay. So most likely may nakapa yata ako something, no? Kaya ako biopsy. Okay? Okay. So it turned out to be benign. Lucky for you. Okay? Okay. Now, yung iba naman, no? Pag wala akong nakakapa, this is my practice, no? I think some of you are present here. Okay. Some of you, I see. Wala na yata iba. I saw one attending kanina. Okay. Nawala siya. I think I won't mention the name. Okay. So a lot of these patients who have virus 4 suspicious, alarming nga, very alarming, very anxious now. But do not jump the gun or na magpapabiopsy kayo kagad, no? So papalpate niyo muna sa isang breast surgeon. I usually palpate it first. If I don't feel anything, and then I look at the interpretation of the radiologist. Kung rational siya, may basis siya. Kasi as I said, these are just interpretation of the radiologist. Kung minsan subjective lang yon, di ba? Hindi siya very reliable. So my usual practice, if I don't feel a mass and I have some doubt, no, as to the accuracy of the report, no, I had a second opinion, no. I have it done in another center, no, in another hospital, in another diagnostic center, but without telling them that of the previous report, no, para hindi sila ma-influence, no. So a lot of times it will turn out to be virus 3. So kung naging virus 3, masaya ka na, di ba? Okay. So what will be done thereafter is just monitoring. No? Okay. Okay.
Okay, thank you, Doc.
Okay. So any more questions? You were raising your hand, Abet, kanina?
Dr. Joson. There is a question from, let me see, I cannot read it. Jocelyn T.
Yeah.
5 months after being operated with pilodis tumor, sometimes there is still pain. Is it normal?
Yeah, it's normal as long as there's no lump, no recurrent lump. Okay. It's still normal. You can have some. you can have some pain 5 months after. One, it could be a residual of the effect of the operation. Okay, kasi yung talagang complete healing ng mga sugat-sugat, it will take years. Yung talagang yung walang-wala na, no? It will take years talaga, no? But you have to distinguish the pain as long as there's no lump there, no? Okay? But you have to distinguish, baka yung pain na yun, baka because of your hormonal changes, o baka nabangga ka lang, o nauntog, no? No, gano'n, no? Okay. So don't worry about it as long as there's nothing
No
unusual,
lump.
no lump. Okay.
Okay, thank you.
Okay. So Vivian was about to say something. Vivian, I saw your.
Yes, Dr. Joson, good afternoon.
Uh-huh.
I am here to raise my personal awareness as a guest of Susan Argel, and thank you for all the good things you're doing. Question: I have run into people who are apparently in pain, but are so afraid that they're in a state of denial. They don't want to visit the doctor, but they're in pain na. So by the time they go, ayun, gone. So how can we help them move from denial? Hindi ba para bang, ay hindi mangyayari sa akin to. You know how that goes, right? How do we help them?
Education lang. Education, and then education, and then if I just do the education myself, mukhang hindi rin ubra. Kasi I think for the past 2,000 years, in-educate ng public by the doctors, di ba? Okay. So it has usually personal attitude na yun, mindset na ng pasyente, no? And probably even the relatives, kumisa cannot convince their own relatives to see a doctor, di ba? Ang hirap.
Yun. Paano pag ganun, Doc? Yung kinausap na, di ba? Ng kapatid, ng asawa, ng nanay, ng tatay, ng anak, lahat para bang, hindi mangyayari sa akin to, pero para bang she's always in pain. Kawawa naman. What can we say? Yun, ano yung magic words na sabihin niya, sige, punta na ako, Dr. Joson, or any doctor for that matter?
I really don't have a one definite way. Just a matter of convincing him or her, no? Kasi in the end, they have their life to live. They have their own decision. We cannot really force them, no? But we can just convince them. No.
Thank you.
Even yung mga patients for operations, I cannot force them if they don't want to be operated on, di ba? So ganon, no.
Salamat.
Ito kasi kahit na yung mga bukol na not only pain, kung pain lang, walang problema. Pero kung may bukol, in denial nga sila, ay wala ito, di ba? So pagdating sa akin, pagdating sa mga doktor, yon yung mga nakita niyo sa pictures kanina, no? Yung sumasabog na, no? Okay? In that stage, mahirap na operahan yon. No? The prognosis is bad already, no? Okay. So they have to undergo usually chemo first. Pag sinabi yung magki-chemo, lalong ayaw na nila, di ba? Okay. Yeah.
Thank you po.
Okay, you're welcome. Any more questions? Who is a psychologist here who can help answer the question of Vivian? Paano? How to convince? Anybody? Any more questions?
There's nothing at the chat box.
Okay. So breast cancer. So tandaan niyo, basta ang pinaka-importante, do breast self-examination, do it on a monthly basis, mas maganda. Okay? If you forget it, do it the next month or any day, no? Okay. And then look for a lump. Look for a lump. No? Don't rely too much on mammography. Don't rely too much on ultrasound, and don't rely too much on the doctors also. No? Okay. Do your breast self-examination muna. Kasi pagpunta niyo sa doctor, okay, pag mammography, it will be months after, di ba? But you do it every day. At least monthly. Kasi everyday naman naliligo kayo, di ba? Once naliligo kayo, nakakapa naman yung breast ninyo, no? So take the opportunity to palpate your breast na rin. kahit na haphazardly, no? Okay. Seconds lang naman yung ano a little seconds of concentration on the breast. Kakapain lang ninyo. Kung wala namang unusual, then let go. Walang problema. Diba? Okay. Okay. Any more question? Any questions? Wala.
Hello, Doc. Vivian again.
Oh, sure.
Yes. I've met various women, no? And there's yung iba, they just you have an operation and have it removed. Then there's this one girl, she's the only one I know. Siguro ngayon early 50s na siya, no? Pag tinignan ko siya, sabi ko, parang walang nawala. Is that your bra? And she said, no. Ano yun? Nagpalagay daw siya ng something after, and she looks, even if she's stark naked daw, she looks like she has breast. So, siya pala nga nakakausap kong ganun. Is that good or bad? Para bang, ha? Hindi ko naintindihan.
Those
Ano
are
yun?
implants. Pwedeng implants. May implants sila. Cosmetic. Plastic
Is that a
surgery.
good idea? Well, I thought I'd ask you para bang vanity na yun, syempre. And of course, she said also because she was getting depressed and it's a decision she made. But frankly, is it a good idea?
It's an option. It's an option that we offer to patients because, as we said, yung treatment of the patients, not only the physical but also the psychological part, di ba? Okay. So, kung minsan, ayaw nilang pa-opera because ay, madideform yung womanhood nila, baka sabihin nila gano'n. So, they're given an option to have an implant, no? Okay, mga parang artificial na prosthesis, no? Parang may boobs na rin, di ba? After the operation, no? So pwede yon, but it all depends. It all depends kung advanced na, usually hindi na, di ba? Kung early stage, maliit pa, magandang prognosis, no? Very small chance of recurrence and good chance of survival, then you can put the implants there, no? Okay.
Hindi ko tinanong.
Pwede sa pwede. Option.
Akala ko, di ba yung some have, ano ba yun, nagpapalaki. Di ba yung mga babaeng nagpapalaki ng kanilang boobs. And then kahit na yung mga gay, I've met some gay na nagpapalagay. And syempre, the news that I received was, why don't do that? Kasi you're putting, outside material in your body. So when I met this, di ba, parang bang naglagay ka ng something. So nung tinanggalan siya, nilagyan siya, sabi ko, ba't ganun? Hindi ko naintindihan, do.
Okay. And then, probably ang perception mo, okay, there are two, yung mga sinabi mo nilalagay, no? Okay. So some hindi inject din sa breast tissues, di ba? Oil, ganun, no? That's one way, no, of doing, enlarging the breast, no? Pero we don't recommend that because it's maraming complication yon, no? So the other way is just put parang may bag siya, artificial bag. Iaangat lang. So mas okay yon, no? Okay.
Talaga. Okay.
Mas okay yon compared to injection, no? Yung iba, yung mga naririnig mo, yung mga gay, yung mga sa parlor, yung mga gano'n.
Oo.
Okay, ini-inject yon, yung mga ini-inject ng oil, no? So up to now, marami pang gumagawa, but again, despite the doctors telling them not to do it, no? So ginagawa nila pa rin. Then after 10 years, probably nagsisisi sila. So they ended up, because once you inject some dye there, it's hard to distinguish from breast cancer na kasi puti. Okay, so usually they're recommended to remove the entire breast and then palitan na lang ng bag, no? Ganon. So yan ang bad type of breast enlargement, no? Method, no? Okay. So yan sinasabi ko, yung mga bag, yung mga silicone bag na nilalagay underneath the muscle, usually underneath the muscle, no? Okay.
Oh, okay.
Okay.
Thank you.
You're welcome.
Okay. There is another question from Jacqueline Tong. Is it normal for a woman who is menopausal to feel tenderness in the breast once in a while, similar to what we feel when our period is about to come? What could be the cause?
Hormonal pa rin. Hormonal, most of the time hormonal pa rin. When you say menopausal, it doesn't mean that completely wala ka ng hormones, Jackie, no? Okay. So meron pa rin residual hormones, no? Okay. Kasi your estrogen is coming from somewhere, meron pang somewhere else, no? Adrenals, gano'n, no? So basta yung pinaka-importante, walang bukol, no? The moment you
So-
feel pain, whatever type, whatever the cause, you don't know the cause, no? Basta kapain lang niya yung breast ninyo. Okay? Pag walang bukol, don't worry. Just continue observing. No? But the moment you feel lump, no? At kung masakit, mas maganda nga. Okay? Lump na masakit, no? Mas maganda. Because of chances of its being benign is greater. Kesa yung lump na walang sakit, na bukol na walang sakit, mas nakakatakot yon, no? Okay.
Mhm.
Okay.
Okay. Can you expound on that hormone replacement therapy? Isn't it some women who are menopausal are being advised, you can do HRT. It's supposed to help replace the estrogen that we lose when you become menopausal. But they say that it's harmful also.
Yeah, it has been reported there's a risk for taking the HRT. When you say HRT, you give the hormones, estrogen, progesterone, when you are menopause already, and then you want to avoid you want to prevent the mga side effects of menopause, like hot flashes, no? Yung mga ganon, no? So that's why that treatment was being recommended even up to now, pero a lot of people, a lot of doctors are shying away from that already, no? Okay. Because of the risk of breast cancer nga, no? Okay.
Mm.
So
Okay.
kung talagang severe na severe yung side effects ng postmenopausal, we call that postmenopausal syndrome, hot flashes, and then tightness, yung dryness of the vagina, ganon, no? Okay, itchy, no? Then take it. You can take it, but be watchful of the possible risk of breast cancer. Ganon.
Mhm.
Kasi you don't know naman kung talagang tatamaan ka ng breast cancer, hindi, no? But binabalance mo lang yung benefit and risk. Kaya kung talagang severe na severe that you have to take it, but take it with caution na lang. No?
So what would be a safer alternative?
Safer alternatives. So number one to psychologize yourself. Baka in due time mawawala rin yun, no? Just try to think of some activities that will deviate, that will prevent those side effects of postmenopause from occurring. And then, I don't know of some alternative medicine that they use, no? So you can read on that, no? Yung mga natural medicine, natural herbs, mga ganon, no?
Yeah.
But sa akin, basically, it's just a matter of accepting and then parang dinideviate mo lang, keep yourself busy, no?
Mhm.
Ganun lang. Natural lang.
Thank you.
You're welcome. I think Jocelyn, your experience that also, hot flashes ka mo? Jocelyn?
Yes, Doc.
Oh,
Still having hot flashes, but it was lessened now by Dr. Ko's prescription of Lyrica. I'm taking that every night.
Lyrica.
Yes, it's an anti-epilepsy medicine, but it helps with hot flashes. And it gives me 2 to 3 hours of sleep.
Menopause ka na ba?
Yes, I'm 60 already.
Okay. Okay, so hot flashes. Okay.
Yes.
Okay. So Lyrica, I'm not aware of that. Lyrica.
Yes, I'm taking the generic, which is Gabica. Gabica is a generic kasi mas mahal yung Lyrica.
Okay. Yeah, Lyrica is more, it's more on, if I remember right, it's also, ano, parang sa nerve yun eh, no?
Yes,
Diba?
nerve and antidepressant and anxiety medicine din eh.
Oo. Oh, sige. Kaya nga, so, so sorry baka ano ka lang, depressed ka lang. Not because of your menopause.
But I feel the hot flashes talaga eh. 24/7 eh.
Oh, sige. Okay. You can do it, but I think you can do it with the natural way. Tingnan natin kung tatagal yung lirika mo.
So far, it's still working, Doc.
Okay. So any more questions?
Last question, Doc Joson.
Sure.
What is your stand on people saying na if you have health challenges of any kind, but particularly on cancers and breast cancer, which is supposed to be the emotionally nurturing cancer, di ba? Ang sinasabi, stay away from the energy vampires in your life.
Stay
Yung
away.
mga toxic. Stay away from energy, yung mga toxic sa opisina, sa bahay, yung sigawan, away-away,
Yeah.
yung mga undesired. Sabi naman ng isa, paano ako, opisina to, pag nag-resign ako, wala akong pera. Tapos, di ba, pag sa bahay naman, kalaban niya, biyanan niya, paano ba to? So, this might sound ridiculous, but it's true and painful situations na, paano yun? Yung toxic ay kasama nila sa office, kasama nila sa bahay.
Okay. Can somebody answer that? Yung ano, may mga psychologists ba dyan? Lynn, can you help me answer that, Lynn? Si Lynn Monsanto, magaling yan. Lynn, it's more people management na yan eh. Okay.
Unmute,
Unmute.
din, naka-mic.
Unmute ka, Lynn.
Okay. Yeah, I believe stress is a big factor in managing our a cancer. No, in fact, from experience, I'm generally a very positive person. But then, for 5 years, nag-alaga ako ng anak na may lupus, and it was very stressful. And syempre, drain ang energy mo, drain ang hindi ka nakakatulong magbabantay ng pasyente, pabalik-balik sa ospital, drain the resources mo. So it was the most stressful time of my life nang magka-lupus ang anak ko and namatay eventually from complications ng lupus noong 2018. And then that same year, na-diagnose ako ng cancer stage 2 ni Doc Joson. So from then on, I said I'm shying away from any form of stress. Pero kung minsan hindi mo talaga maiwasan or hindi mo ginugusto ang nangyayari. My second son just died last year. My eldest son died na aksidente nang nagbabakasyon lang kami waiting for New Year in Tagaytay. So stressful na naman ang buhay ko ngayon. But yeah, I have a natural medicine doctor, integrative medicine doctor, kapartner ni Dr. Joson, Dr. Dea Miliora. And pag stressful na ganito yung sitwasyon ko, binibigyan niya ako ng maraming supplements. Like pag hindi ako nakakatulog, melatonin niya ako. I have HTN pag nagpa-palpitations ako. And siguro kung minsan, mga 10 yung supplements na binibigay niya. And that helps me manage it. Kasi on my own, I cannot. On my own, ang hirap ng stress. Especially when you are grieving. And yung grieving ko parang from death ng 2018 and then wala pang 2 years, another death, 2 anak ko. So, yun lang. Nakaka-help sa akin yung supplementation. Nag-megadose ako ng vitamin C, hindi ako nawawala ng vitamin C, and what else? I bike, tapos na na-disgrasya din ako sa bike, na ano ako ng isang nagmamadaling car. So, na-stop naman ako ng biking. So, but I think it's important to manage our stress. Kung kaya nating mag-exercise, exercise. If you can do siguro me, I'm writing a book about my first son's bout with lupus. So it helps me at least release my tension, my stress. And yeah, I have a Bible study group, a support group. So nakakatulong din sila for me to manage my stress, because when I cannot pray and I feel so depressed and overwhelmed, then they help me, they lead me to God. God should be in the equation, I think. So those are the ways I try to manage my stresses. Yun lang po. But
Okay.
well, so far, I think nasa remission ako because my test results said wala akong signs ng cancer ngayon. It's been 3 years. Yeah, 20, going on 4. Sa August 20. No August, like going on 4. So 4 years na akong in remission. So yun lang po. So that I can share, Doc. And
Yeah. Thank you.
mga
Thank you for your sharing.
thank you po.
Okay. So Vivian, yung stress na yon, that's not only true for cancer, it's true for all types of diseases, no? Okay, kung saan stressful can cause stroke, di ba? Yung mga ganon. So
Yes.
just a matter of in general, that's why we call that do not respond, you do not react to stress, but respond and manage your stress, di ba? Okay, yung stress talaga hindi siya mawawala, di ba? Okay, so there are good stress, there's yung mga distress, ang pangit, no? Yung mga eustress, yung mga mas maganda, di ba? Yung mga mas maganda na stress that will stimulate you to grow further, to develop into a better person, ganun, no? Okay. So try to manage your stress by whatever means. First of all, try to use the natural way muna. Yung mga tactics that parang biking, exercise, no? That's also one way of, Then in terms of people management, no? You're talking about yung mga stress sa trabaho, no? People management lang yan di ba? So how to deal with these people. If you cannot deal with talagang sinubukan mo ng lahat na hindi mo talaga kaya, it's umalis ka na lang o kaya paalisin mo yung yung subordinate. No.
Yeah.
Okay. Okay.
Remove the toxic or shy away from toxic people. Number one stressor sila. Wala kang choice.
Okay. Okay.
Thank you po.
So any more? So early diagnosis and treatment. So be inspired by the 110 breast cancer survivors that I have. One of them is Linde, pero wala pa siyang 10 years. Hindi pa siya kasama doon. Malapit na. Okay. And then, so yung mga 110 cancer survivors, usually early stage sila. No, early stage. Then they have different types of treatment. Some no chemo, no hormonal, some with hormones, iba-iba, no? So ako, I don't go the cajon, no? I just do it as indicated. And then a lot of times, patient-centered ako. I ask what's the choice, what's the preference of the patient. I let them decide, no? But I usually give them the options, no? Okay. So ganon, no? So be inspired by the so early diagnosis and early treatment. Ang pinaka basic strategy do sa early diagnosis is your breast self-exam. I want to emphasize that breast self-exam, which I'm going to talk further next week, no? Okay. I'm going to amplify on breast self-exam, in which I want to tell you, pero sinabi ko na sa inyo kanina, rely on breast self-exam. Do not rely too much on the lab or your doctors. No? Okay, kasi you see them once in a while lang, di ba? Pero yung sa breast self-examination, dala-dala niyo yung breast niyo, di kapainin niyo, no? Okay. So kung di niyo na Kasi yung mga examination of doctors can also be erroneous. And then the mammography, yung mga BI-RADS niyon, na nakakatakot. Ano? So, kung mali siya ngayon, hindi niya na-detect, if you wait for next year, malaki na yon, di ba? So, but if you do your breast self-examination monthly, kung may lumabas, makikita niyo kagad. No? Okay. Okay.
Yeah, I would like, Doctor, there's a message for Mom Lynn from Jacqueline Tong. May God bless Lynn with strength and fortitude and peace of mind. Also from
Thank you
Rochelle de la
very
Cruz. Thank you for sharing at Lynn Monsanto. Sorry for your loss. I am happy for you that you were able to move on and stay positive. Keep the faith po.
Thank you very much. That's very encouraging.
Yeah, congratulations, Lynn. No?
Salamat
Sorry,
po.
sorry for the loss of your son. Also, yung nagbabike, no? Sayang.
Pasyente niyo rin po yun. And
Oh,
bike body ko yun. So,
oh,
really.
okay. So, it's 3:15. If there are no more questions, can we call it a day, or do you still want to have some questions? Okay, it's nice to see new faces today. Vivian, Lynn, and Dana Abiera. Dana is new, di ba? Okay. And then Christine, welcome back. Christine, welcome back. Okay. So if there are no more questions, we'll call it a day. We will be talking about breast self-examination, a health habit to cultivate. I'll try to convince you to do it. Okay. And then
Doctor, also Ma'am Felicie.
uh,
Ma'am Felicie it's her first time.
Feli. Feli is second time. Okay, Feli, yeah. Okay. Feli, can you narrate your experience? Kanina, because Susan was asking a question, it's related to your case. You know? Kasi nawala ka kanina eh. No? Would you like to share? Would you like to share? Para marinig ni Susan?
Well, because sorry, Doc, I'm not good in narrating.
Taglish. Yan. Share. Sige. Sige, go ahead. Talk na. You're mute, you're unmute na. Okay na. Anyway, Susan, si Peli, I think she had a ultrasound and mammo by REDS 4. And then I had it just this year. So I had it repeated in another center, naging by REDS 3, no? Then 3 months again, 3 months, kasi 3 months, mga 3 months after, she repeated it another center. So 3 hospital na. So by REDS 3 pa rin, no? So kung may two by REDS 3, that's more convincing na, di ba? Kaysa by 1, kasi kung by REDS 4 then 3, baka hindi pa masyado convincing, di ba? So she just have to trust me, di ba?
Si Abus lalo kung Abus isip.
Then she said that she wants to have it in another center, 4th hospital na, 4th clinic. Just to make sure it's really by REDS 4. No? Okay. Kaya importante yung check-up. Okay. So when I say most likely there's nothing wrong there, but you should have a regular monthly examination. Breast self-examination, and then my palpation. Kasi just to catch kung sakaling nagkamali tayo, makakatch pa natin yon, no? Okay. So there are a lot with BI-REDS 4 naging BI-REDS 3. Diba? No need for biopsy, no need for operation, no? Okay. So with that, I think we will call it a day. It's already 3:18, so we'll see each other next week, no? So Before I leave, sandali. Sandali. Wala. Si Phoebe. Phoebe, kompleto na yung ano mo, breast self-exam group mo. Phoebe. Unmute, Phoebe.
Well, yes. Kompleto na po.
Kompleto na.
Na-submit ko na. Yes.
Sige, I might give out the cash award already. For the information of everybody, I'm giving out the cash award. Now, incentives for those who have been doing breast self-examination for the last at least 6 months. Yeah. So 500 each per person, okay, who have been doing breast self-examination for at least 6 months, and then 1,000 for the breast cancer survivor. Phoebe, pang ilang years mo na?
6 years po.
6 years
6 years.
breast cancer
Yes.
survivor, and she has recruited other 5 members to do breast self-examinations. Okay, so we're trying to protect the other people now. So I might give out the cash award next week already, starting next week. We don't have to wait for the December gathering. No? Okay. Okay.
So,
Dr.
I
Joyce.
have a question. Pwede pa?
Pwede. Sino?
Lynn, Doc. Oo.
Alin?
Paano? Pag na mastectomy, total mastectomy na, Doc, paano mag self-examination? Wala ka nang kakapain. So what do you look for?
Kapay, number one side lang yan, di ba?
Yep. No, one side
So
lang.
you still have the other side. Okay.
Yeah. But dun sa side na nawalan ka na, how do you do the examination?
Kapay mo
May
rin.
possible, ha?
Kapay mo pa rin. Possible may recurrence.
Yeah, that's yung ano ko.
Pwede mag-recur.
Kakapain pa rin. Pero di ba tinanggalan na rin pati yung mga pati yung nodes.
Yeah,
Yung
kakapain pa rin.
wala.
Ganun pa rin. Kakapain.
Okay.
No?
All right.
So, kakapain pa rin kasi that's why when you go to my clinic, kinakapa ko, di ba?
Yeah, opo.
Okay. So, I kapa for local recurrence, no? Baka yung mga natira, no? Okay.
Okay, Doc. Thank you, Doc.
Okay. So, there are no more questions. We'll call it a day. Thank you for listening. Thank you for joining. Thank you for interacting, sharing, etc. Okay. So,
Thank you, Doc.
bye-bye.
Doc, salamat po.
Bye-bye.
God bless you, Doc.
Okay, bye-bye.
Thank you. Happy weekend. Bye-bye.
And
Bye.
also,
And
bye-bye.
everyone, God bless you.
Okay.
Bless